Hello everyone, I am Dr. Ashish Ahuja and I welcome you all to the second episode of Innovative Talks in Ophthalmology. Today I have with me Dr. Nilesh Kumar, who has done his MBBS from Kasturba Medical College in Manipal and his DOMS from JN Medical College in Belgaum. And he was a DNB resident at Lotus Eye Hospital, an institute in Coimbatore. He is a comprehensive ophthalmic surgeon currently undergoing retina fellowship at Patna, while he's also setting up his own private practice. So he has innovated a novel smartphone-based gonio imaging device, which has been awarded at multiple innovators sessions and conferences. He has received a lot of acknowledgements for this device. He holds a special interest in academics and research, and he has authored more than 65 publications across peer-reviewed journals, and over 40 papers have been presented in various conferences. His current area of research is basically with smartphone-based imaging and medical retina. So it's great to have you, Nilesh, on this
Thank you, sir. Thank you so much, sir, for this
talk.
opportunity.
And so let's start by, how did you get this idea of coming up with this, gonio imaging device, or how was that, problem which struck you?
Sir, as it happens with all the innovators, like we do not seek to invent or innovate anything. It just we get to a problem, and then we keep thinking how to solve it. So this problem I had was to convince people to get a YAGPI done. I was posted in during Lotus time. I was supposed to go to 2 peripheral centers, and both peripheral centers did not have any imaging device. And then it was very difficult to convince those people because they were from villages, and they couldn't understand anything, whatever I told. So I thought how to do it. And then suddenly one day when I was seeing across the slit lamp through the gonio, I saw that I can see all the 4 mirrors. So I was like, if I can see all the 4 mirrors and I can see some amount of angle structures in it, then if I take that photograph with the phone and magnify it, can it be done? So that was the whole idea. And I was very skeptical because to think something that nobody has done before. So I was very skeptical. I thought that somebody must have done it. So to validate that idea, I took just one patient somewhere in a closed corner of the hospital, and then I was just going to click the first photograph, and luck has it that Ashish Sharma sir walked in during that time when I was clicking the first photograph, and he's like, "What are you doing?" And as you know, he has innovated his own smartphone fundus photograph. So he was very interested, and then that collaboration started, and then he was all the more encouraging.
Awesome. That is very great. And yeah, that is how, the mind works. So, because it is very difficult to convince, patients will say, I don't have any problem, my vision is good. So, I think this imaging.
Yes, sir. Even the literate patient, they don't understand unless you show something to them.
Yeah, I think you have done a study also, no, where
Yes,
the conversion rate has increased because of
yes, sir. Yes.
documentation.
So we did a double 2-arm study where the traditional verbal counseling versus the YAGPI, and for YAGPI and the conversion rate using the image-based counseling. I think it is nothing new because any image-based counseling, if we do, then we will have the same conversion rate. The only thing is that we have done it with gonio image. So it was 50% with the traditional, around 51% with the traditional, and around 90% with the DICS-based counseling or the image-based counseling. So having image is always good.
Yeah, that is a very significant conversion. So I congratulate you for that. Could you tell me what were the key challenges in your journey while developing this DICS Pro device?
The first and the major challenge is coming over that mental block. So to think that this can be converted into a device, if And I keep saying it again and again that if Dr. Ashish Ahuja was not there, I couldn't have done it, because he has done it. So I knew that it can be done. And he was all the more encouraging that if you don't make it to a device, then it is of no use, because nobody is going to try something new or some jugaad kind of thing. So that was the thing. So the basic thing started is like how to get the centration right. That was the only aim, to make the device first. So the team that worked with Ashish Sharma sir for the Redcam design, the same team worked. So we started sitting on sessions. The major challenge was that we can't have a coupling and then go on to the patient's cornea, because then the weight of the phone and the device will be too much to put on patient's cornea, and then everything gets distorted. So how to get a gonio adapter design, and then a smartphone catcher design, and then to make it align. So everything was in that. And once we got that right, we saw that, okay, there is a centration that we can take. Then the idea came to add a macro lens, so that we can get some kind of optical magnification instead of going for a digital magnification. So that was the second thing. So the main crux that what I thought was to keep thinking on how the design can be improved, because you don't have to think as an inventor or an innovator. You have to think as a consumer, or the person who is using the device. Then you will think that, okay, this thing is so initially we had something like it has to go like in a form of viper. So that it was very difficult, because when I was getting it centered and then tightening the screw, then suddenly it moved. So it was not very easy for me to use. So as an innovator, it gets very difficult to discard an idea that you nurture. So that is the key thing, that you have to be very ruthless with yourself and keep discarding your ideas, so that you can get to a better one.
Yeah, that's a great point. I think so. I think for ophthalmologists in their residency or early year of their career, I think identifying a mentor is crucial. Get
Yeah, yes, sir.
maybe seniors in your city, discuss with probably people who have developed some devices earlier, who have patent
Okay.
in their name. So that will help to accelerate the innovation
Yes,
journey
sir.
and avoid mistakes which they have done themselves earlier.
Yes, sir.
That is one key thing.
Another thing is that the trust factor is also very low in our community. That is a very sad truth that we face every day. That the residents are not very trusting towards their professors. They think that every senior or every consultant that is there, they will steal their ideas. But that is not. You need to see. You need to analyze. Don't go on discussing everything with everyone. But then you need to identify the people who have good character and good morale. So for me, I was lucky, because I didn't analyze this. But then when I keep talking to other people who are into innovation, they have faced this thing. I was lucky, I didn't face it. But then we have to take that plunge and get a mentor. So even if a mentor is working with you, even if it is not from your institute or from your city, then you can just reach across via internet, via WhatsApp, via email. And everyone, I think there is a close knit community, and around you will get 2 or 3 people who will genuinely help you.
So nice. I think you have addressed the key learnings also, maybe from your journey through this. I think not to have ego is also crucial. We have to
Yes,
be very stringent, and keep trying to improve on
yes,
the
sir.
designs or the existing ideas. And
Yes, sir. That is one very important thing that my father keeps telling me, because he is not happy with my product at all. To be frank, he is not at all happy, because he doesn't think that smartphone sensor is giving that much details. So we and that is true, that the current device, it can only classify open and closed angle. It can't pick up very subtle pathologies. So he I think every 2 or 3 days he keeps telling me that, now what are you doing? You have stopped working on the device. But there are various ideas that come into head. But then now to take it to a next level, it becomes very difficult, because you need now specialized people to help you. Like you need a good camera person to help you, good LED person to help you, and all that. But then you have, if you are happy with your device, then you won't be growing. That is the truth. That you can't be happy with your innovation. Then only you are going to keep innovating throughout your life.
Nice. Acha, have you filed for a patent also for the?
Yes, sir. We have filed for a patent, and it has been examined also. There is only one catch, that we have got only one comment during the examination. So, and it is very, it is not actually pertaining to our device. It is just that the names have coincided. So that is very easy, I think, to overcome. But yeah, we are going ahead, and that is also one thing that all the innovators who don't want to discuss their ideas beforehand with their mentor or with the industry people or anyone who is developing it. So I think so they should file for a patent and then sign an NDA with the person who are discussing with, and then take it forward.
Yeah, that is a good way of approaching. And what is the approximate which a person has to incur to
So the patenting is not that costly when we compare it to the amount that is invested into developing the device. So it was around, I think, 4.5 to 5 lakh to get the first lot completed of 25 devices. It was around 4.5 to 5 lakh. Because it included the R&D cost. There were multiple prototype, and each prototype costs you around 40 to 50,000 rupees, and then you keep improving. So there are multiple layers to it. So that was the first cost, and till now I have spent, I think, around 50 or 60,000 for the patenting, and there might be 10 or 20,000 more. That's all it takes to protect your intellectual property.
So that is good. I think this is
Yes, sir. It is good, sir. And a lot of people, they don't know that they can patent their ideas also. It is not that you need a device or a sketch or something, but the idea also can be patented. It will be patented for a year, and then after that you have to file for a concrete device on it. So that can be done. And it costs around 10,000 or something. So I think that is very affordable to protect your idea.
nice. I think a lot of residents and young ophthalmologists would be inspired after this video. So, can you tell me how has this journey of innovation, changed or affected your career so far, or why should a resident think about innovating or step out of the comfort zone?
Sir, frankly, I am speaking to you as the major change that it has brought to me, brought to my career, because now I can actually approach people and be comfortable with them, and then have a standing. Because if it is only one product and it is only like a basic level product right now, but still it has given me so much that I get connected to all the leaders in ophthalmology, and that allows me to learn more. Because when you are interacting with people of uh, uh, innovative minds like you, Dr. John Davis Akkara is there, who is very innovative and very encouraging. Dr. Prasanna Venkatesh is there. Even Venkatesh sir from Pondicherry. So I can speak to them, I can speak to you, and learn is the most important thing that this has given me. The innovation, and all the resident, I want to tell that uh, don't. The only thing that this feels like a gyan when I give it to them, but I tell them that don't start thinking that I have to innovate something. You just start focusing on the problems that you are facing right now, and then you will hit a solution. So you need to find the problem first. Don't start thinking that you need to innovate, you need to innovate, you need to innovate. And once you get the innovation done, then you have to take it to the next level, and that is going to change the trajectory of your career completely. Like the most first thing that it gives you is confidence. So much confidence that when you talk to your patients, even they feel that this guy knows something. Because I might not be knowing everything in the ophthalmology, but when I talk to my patients also, I have that confidence that uh, so many people are backing me up. So so
Yeah,
that
true.
is so
A
it
big
gives a
difference.
wholesome, it is not a linear effect that it gives. It gives a wholesome effect on your life, sir.
Yeah, I think it affects a lot of things, as you said,
Yeah.
and I feel everybody should, at least try and discuss and maybe even collaborating with
And
engineers
yes,
and
sir, when we discuss with the when we discuss with anybody who is doing surgery or something, everybody innovates per day. I think any surgeon has to innovate because every case is different. So everybody has to innovate, and any surgeon who is good is innovating in his or her own way. But the problem is that they don't realize that they are innovating, or they have that mindset. If they're a good surgeon or a good clinician even, then they will be innovating. They will be having some funda that works for them. The only thing is that to take that funda and to make it accessible to everybody.
Great. I think so. These are some very useful pointers, and I am very inspired, interacting with you. And I hope you, uh, work on many more devices and, make all of us.
Likewise, sir.
And
It is always inspiring to interact to you.
looking forward to meeting you in the upcoming year
Yes, sir.
as well.
Yes, sir. Yes, sir. Very soon, sir.
Chalo, then thank you for sparing your time, and let's sign off then.
Thank you, sir. Thank you so much.